Thank you. Thank you, Caroline. I think we've got 20 minutes left, and rather than me ask questions, I'd quite like to throw it over to the audience. So if anyone wants to ask questions of the working poor of the business world, now is your time. So please, I'll pass it around. And if you could put, just when you ask questions, ideally keep the questions reasonably short, and if you can just say your name at the beginning. Thank you. Sorry, is that? Oh, sorry, Joe. Yeah, no, go. No.
So I wanted to ask you, on the way to your final chapter, you were talking about having set up a shared, if you will, support system for administrative fiscal support, purchasing, et cetera, to support the satellites or the franchises. I'd be very interested in the financing of that and the sort of important role you felt it might play, because I think we've been talking about this question of how might you think about more collaborative support for entities that may be out there but don't have the infrastructure or couldn't afford the infrastructure unless it was shared. Thank you.
I'll just take a couple more, and then we'll try and organise responses. Yes, please.
Jim Jones with ExxonMobil. I was really interested, Caroline, thank you. It was a really rich discussion from all three of you, but I was really interested in this issue of challenges that women particularly face as social entrepreneurs. We know that there are more than 1 billion women in the world who lack access to financial services, and I wonder if this is borne out among the social entrepreneur sector, and if you all are collecting gender-based data on this.
Olashupo Yedepo, I'm with the Health Strategy and Delivery Foundation in Nigeria. My question is for Caroline. You mentioned bridge loans. Compared to other sources of these loans or funding, how cheap are the loans you give out? Is there a cost to those loans?
Great. I'll take one more, and then we'll allow Lisa and Caroline to answer.
Thank you. My name is David Greeley, and I'm with the American International Health Alliance. We're a nonprofit organization that does health system strengthening and human resources for health. But my question is on the verdict on USAID support of social franchising and social marketing for years. There are others as well, but USAID has been very much behind that. What's the verdict on the success of those programs, but in particular the conversion of some of those programs to locally led, profitable enterprises? Have they been converted? Thank you.
Thank you, Joe, for your question. So within the franchise, so we ran what's called a full business format franchise, in the sense that we controlled all the aspects of the service delivery. When we talked to nurses in rural areas about their needs and about the kind of support that they would need, procurement kept coming, right at the top, but I would say next to financing. And so one of the things that the franchise outlet organization does is also provide the financing. And I spent many years looking for alternatives. When we would talk to various donors about that aspect of the fact that they were running a social enterprise in a village, they were charging, a minimum fee, but a fee for the service. A lot of people felt that, then it should be possible for them to get financing for their clinic from commercial banks or elsewhere, but it just is not available at that level and to these types of. So financing was a big part of it. And then the procurement. And so we would do central procurement, and being able to take product that the nurses did not have to go around looking for that good quality product and the time spent on that. So we would deliver the product all the way to the clinic. So the nurse just comes in and opens and, would get a turnkey operation and start. It was very, very much appreciated. With LiveWell, where we've evolved over time is now where we're really looking at networks, because I agree with speakers who were talking before about this whole fragmented elements of, and especially in service delivery. If you look at private sector, there's a lot of individual, organizations just trying to do the best they can, and we're now looking at having, with my experience in franchising, but extending beyond franchising to look at, can you actually provide networks of primary care clinics and do the central procurement and do the central support. So I would say that it was a very successful part of this. Just to comment a little bit to David's issue on verdict on USAID, I cannot speak for other organizations, but our franchise organization did receive co-funding from USAID back in the day, and that funding was really very important and very critical. And we also, as Chris said, it's not just about the money. We also received very, very critical, shall we say, technical assistance, and worked with MSH, for example, that really helped us with the training, the setting up of the systems, and that kind of support. I will just put in that my personal experience with all of these is that, again, and I totally agree with Chris. Remember that innovation, that 71%, when you're in there, you get a lot of interest, many small grants, a lot of opportunities to talk about what you're doing, but no, it didn't extend from there, to any sort of scale.
On the loan and pricing question, so we are a philanthropic initiative and believe that the majority of the value should accrue to the social entrepreneurs. So we offer below market interest rates. For nonprofits, that equals about 1 or 2%, and for social enterprises, that's around 5 or 6, compared to market rates of 18. On female entrepreneurs, thank you for asking that question. Because we have no sector geography focus, we've left it open for a while, and actually this year we just surveyed our portfolio to see what the percentage of women founders was, and it was about 16%. So in venture capital in America, only 3% of female founders are getting money or are receiving funds. So we're doing about 5x better, but still not good. And I do just want to bring up, we had a good discussion at the Skoll World Forum this year around sexual harassment for female founders. And unfortunately, 100% of the female founders that were part of that discussion had experienced some form of sexual harassment during their fundraising process. And so that's a fact that we also have to contend with.
Just to add to that, having probably over the last 10 years helped set up and fund over 50 social enterprises run by men and women, and probably actually reflecting your percentage, Caroline. I've found no real difference in the quality or competence to execute at scale and well. The difference I found, and maybe it relates to the point you made, is a lot of the organisations that I've supported being set up and run by women are significantly less funded than those by men, and either that's a male sort of risk-taking behaviour set of raising money or networks, but typically, in my experience, the ones run by women are far less resourced externally than their male compartment. I've found no significant difference in competence or capacity. The reason I answered no, I don't know whether this sector will achieve its objectives, is not because of the disruptive or innovative or catalytic nature of these enterprises. I don't know whether the right type of support is there to allow this sector to grow, and that's where I start looking the public sector in the eye, as well as the private sector. A lot of public sector will not give funding to a for-profit, even with a clear and explicit social purpose. Question to you, why? Secondly, what is wrong with instruments of finance other than just a grant that expects impact and no financial return, and an investment that seeks a return on capital? What's wrong with getting 50 cents back in a dollar and impact? Why doesn't that funding exist? Because that's the blended finance that is going to take this sector to scale. So I'll abuse my position as a moderator, throw a question back to all of you. How do you think you can help this sector grow? Please, someone answer now. Yes, thank you, Joe. Thank you.
While other people are thinking of their questions. I've been to a lot of forums in the U.S., admittedly. I'm sorry? Yeah, it's on now. Yeah, I've been to a lot of forums in the U.S. talking about social impact investing, social entrepreneurship. I think one of the issues is the marketing of what it means. So many people arrive and think, oh, these are rich people who are going to invest in social good. And then you find out the return on investment is not gone at all. In fact, and it is below market, to be sure. It may be, sometimes it's not any slower, which is a problem, and they're not willing to hang in for longer than non-social investors. And in the U.S. environment, they've been very active in community development, but when you look closely at it, it's healthcare delivery because it's financed by the government. It's supportive housing because it's financed by another part of the government. It's a little bit aging-related day programs, but it's always a third party. It is being publicly supported through, in terms of the sort of first-line investments that these companies are making. So I think part of the issue is unabashedly or unashamedly saying we're expecting some kind of return on investment. Because I think a lot of people come thinking, wow, this is a great, access to, the Facebook entrepreneurs or the Bill Gateses, and they're never going to ask us for anything back, and it's just not the case. So I think some of it is marketing, and it would then everybody knows what the conversation is about, and then some of it is really looking at below market, longer term waiting, and experimenting a little bit with the not obviously immediately reimbursed kinds of services. At least, that's the U.S. experience from being in a lot of these meetings. The last thing I'd say, and it may be more what Sumerian's doing or Caroline's doing, LISC, which is one of the big national community development agencies in the United States that's gotten interested in health, is very invested in helping the nonprofit gain access to capital and provide technical assistance to develop the administrative and fiscal infrastructure. And I'd like to sort of ask about that because I was interested in Lisa's story, but also is that something that that would be really helpful in the social investing side, although it might be a bit of a loss, but long term I think would result in greater return on investment.
I'll take a few more questions if anyone has any. Please.
Lisa, you mentioned that your number of clinics went from 12 to 5. Can you give us some indication of what happened?
Sure.
Hi, Amy Lynn from USAID. Just to quickly respond to Chris and then also pose a question to Lisa as well. I think one of the pieces that we've been thinking about at USAID and as a donor agency is how do we use our role as strategically as possible to help bridge that valley of death that Caroline was mentioning and hopefully escape it. And I think one role that we've clearly heard as we've convened different idea incubators and discussions with impact investors is that handoff. It needs to be there as well. So not just thinking about financing and grant capital from where we're dispersing actual funds, but how do we pave the path so that it's ready, a social enterprise is at the maturity stage where an investor is ready to pick it up. And having that line of sight from the beginning and coordinating from the beginning can be helpful for everybody involved instead of trying to do it one at a time, every time. And then I guess my question for Lisa, or more as a comment, is picking up on what you said about technical assistance. And of course, we worked together briefly about a decade ago, and part of the the idea there was to provide some technical assistance and see how an external view could provide some support. And I think it's just a really recognition of what you've been able to do with LiveWell and adapt to all of the different changes and roadblocks along the way that combines both your strategic use of funding and the technical guidance you've received from Acumen and MSH and others to succeed. And I guess my question to you would be, as donors or others think about what technical assistance to provide, how would you advise us in providing that so that it's as strategic as possible and as tailored to your needs as possible to weather that valley of death?
Thanks, Amy. Rachel's very kindly reminded me we've got 5 minutes left, so if I can ask you to reply to those, and then I want to give you both the opportunity at the end just to say something yourself.
Try and keep it short. Thank you. So, really, in the response to Joe's question, I keep thinking about the issue of scale, and what does scale mean for our types of enterprises? Because for me as a social entrepreneur and for the partners that we talk to, many times that we're looking at very different things. And I think that that's maybe one of the elements that we have not managed to get to in this particular panel, is really talk about all of those challenges of innovation to scale and what does it take. So many of the investors that have come in and aim to talk to us, as I said, lots of interest at the innovation stage, and then have this 5 to 7 year window. It's a magic number. I've never understood what it is all about. But it's 5 to 7 years within which you're expected to achieve scale and graduate, from needing this assistance. Needless to say, I've been working on this for, LiveWell part just maybe 10 years, and we're still far from scale. The issue of 12 to 5, and I actually thought Caroline would talk about the rest of her fantastic study on what affects us social enterprises so much. I think you talked about the top one being donor, the delay. Our experience is just change of strategy. So we had a partner who was ready to work with us and take us to scale at a very, very fast and aggressive pace. And 1 year later, they changed their minds. They changed their strategy completely from working with smaller social enterprises to large, hospitals. It was very, very disruptive for us at LiveWell, and thus the contraction. And then finally on the issue of adaptation, thank you very much, Amy, and yes, we've come a long way. The technical assistance, I would say, it's tailored. It's tailored to the organization and the level that it's at and the kind of need. I will say that, we worked very well together when you came in. You had a particular skill that we needed, and it really helped us. But many times, this whole question of scale, there are very few technical experts out there that can come in and really work with our organizations. As we said, it's beyond money, but also that expertise is not that widely available. So I think it's something that we could, take up as a conversation, because I think that the challenge of scale, not just for social entrepreneurs and organizations, but also many other projects, is a big unknown. Thank you.
And I'll speak a little bit more to our roadblock analysis. So biggest bucket, funder-created obstacles. Beneath that, the top two most frequent roadblocks were delay of disbursement and change in strategy. And just to underline, Open Road only funds projects and companies that had committed funding and then it was withdrawn. So change in funder strategy is not the grant has finished or the loan has finished and then we come back. It's you're in your third year and you get a call and they say, we're not focusing on Kenya anymore, I'm sorry. So funder created obstacles. Second bucket is organization misfortune. So we had a CEO in Ghana get dengue for a second time and had to leave the tropics for good. And there's been, robberies of office spaces. In health, actually, the biggest roadblock we've seen are what we call partner problems. And so our hypothesis is that because healthcare has to rely on, last mile distribution, partnerships with government, there's a lot that is just outside of your organization's, your company's control. And so our recommendation is to have a really thorough partnership underwriting model that can help spot some of those potential risks before they happen. Third big bucket is kind of our catch-all, so we call it acts of God or economics. So you've got your weather events, you've got your currency devaluations, and then changes in government policy that create liabilities overnight. Like I said, we're trying to build this data set so that we can have some sort of statistical significance that can help organizations like Lisa's plan for the future and have appropriate risk management. I'll just end with, I do believe there's a fundamental misperception of risk in the market for financing these social enterprises. And so it is on us and perhaps some of the donors to help build the data set that proves that. Open Road's trying to do that with our roadblock analysis, but I would put it out to the public sector to think about what data they could start taking to the private sector, banks and financiers to help get that money moving.
Thank you. Well, thank you for both Lisa and Caroline for what they've said, for you for your questions. I hope those that said don't know are inspired to think possibly that this is a sector of disruption and innovation that will achieve scale. And do remember that Philips and Medtronic all started as small enterprises once, and look where they are now. So on that note, I thank you all for your participation and wish you a nice lunch. Thank you very much.